Here we are.
On.
Oh, okay. Well, thank you, and welcome back to the Symposium for Media and Health. And we're here for the fourth research panel. The topic of this panel is targeting health audiences via social media. And we have three papers to look at and to hear about. The first one is mental health stigma reduction among Hispanic and Haitian immigrants, leveraging social media to promote offline strategy. The presenters are Maria Elena Villar from Florida International University and Lorene Bauduy from Federation of Families. The second paper is Grumpy, Happy, and Other Smurfs, a content analysis of a Twitter account to find paramedic mood. The presenter is Deason from Indiana University, Purdue University, Indianapolis. And the third paper is Online Engagement and Data Dissemination in Community-Based Participatory Research Studies. And the presenter is my colleague and friend, Jeanine Guidry from Virginia Commonwealth University. There. And as you watch these presentations, we encourage comments and questions via Twitter. The hashtag is VCU Global Health. And so please contribute and add to the conversation there. And after the presentation, discussion will be led by my colleague Marcus Messner, who is an associate professor at Virginia Commonwealth University and the executive director of the Center for Media and Health. And he's right there to my right. So no further ado, let's go to the first paper.
And that would be Mary Elena.
Oh, sorry. Yes.
I forgot to unmute my phone, my microphone. Can you hear me?
Yes, we can. Thank you.
And I'm sharing this now. Can you see my presentation? Hello?
It is. It's not pulling it up into our window right now.
Do you think it's a matter of time, or should I try again?
Well, whenever you talk, your video actually doesn't come up. I'm not sure why that is. You might want to try again.
Sharing my PowerPoint screen. It worked in the practice.
That's what practice is for.
Yeah. Nothing, you can't see my presentation?
Cannot see it.
We can see it. We can see it in the audience room.
Okay, then
yes, we can see it online.
Okay, so I will begin then. Yes?
Go ahead.
Yes, please.
Okay, so it's my pleasure to share with you this project that I'm working with many collaborators and colleagues. One of the most consistent one is Lorene Bauduy, who is also going to be speaking during the presentation. She's on the line. But this is really a broad community partnership. It's part of a county-wide effort to improve mental health services for children and youth that are dealing not only with mental illness but also substance abuse. And specifically, our project is with the family organization related to that project, which is the Federation of Families Miami-Dade chapter. So one of the big aspects of their mission is to reduce the stigma, the cultural stigma around seeking services for mental health services. So as you may know, the population in Miami-Dade County is heavily Hispanic, and there are a lot of immigrants in our community, and the two largest linguistic groups are Spanish for the Hispanic community and then Haitian Creole for the Haitian community. And so these are groups that, because of their different challenges and risk factors of being immigrants, sometimes are the most at risk for mental health and substance abuse issues and the least connected to services and the least likely to access services. So what we set out to do in this study was to better understand the stigma and develop approaches to reduce the mental health stigma in culturally appropriate ways. So in terms of research on the issue of stigma, we've heard a few presentations on that today. It has to do with shame, it has to do with negative attitudes, it has to do with labels, and stigma is one of the greatest barriers to people actually seeking mental health services and treatment. And there's a fear that seeking treatment will actually place the label and exacerbate the already stigmatized identities of people because they are because of their minority, racial, and ethnic group, because maybe they are sexual minorities, maybe they are undocumented. So it's perceived that by seeking mental health and substance abuse services, it will add another undesirable label to the labels that society already places on them. So the overarching goal is to develop strategies for this specific immigrant multilingual population that is in line with the culture and will address some of the stigmatized beliefs. So the research that we're presenting, this is really a community-based kind of action research project. And so we're going to talk about two stages. First, the formative research phase, where we conducted a lot of listening groups with parents and family and youth to better understand the cultural stigma that kept people from seeking mental health services. And then the evaluation research phase, after we developed the materials, to kind of see how they were accepted compared to more traditional ways of stigma reduction interventions. So during the formative research, we really engaged in CBPR, community-based participatory research, where we went out to the community. We worked with the family group to ask them to go to talk to their neighbors and friends and family members and really try to better understand how people spoke about mental health stigma, about the stigma of accessing mental health services. And then part of that formative research was also finding out how they communicated about these issues and to what extent media, traditional media and social media had, were part of their impressions on these topics and whether they would communicate through those media and different things. So based on that formative research, we developed stories based on cultural archetypes and used kind of storytelling. So just there are many, many fascinating and interesting topics that came up, but I'll just quickly mention some common themes that guided the writing. So one is the fear that these labels will be blamed on the family, that mental health and substance abuse will be considered to be a fault, a result of bad parenting or something like that. There's a big belief that prayer can help, and there's a cultural inclination in both the Haitian and the Hispanic groups to first try traditional and faith-based therapies before going to clinical treatments. What I mentioned before, that seeking help will bring more problems, a perception that U.S. culture is very medicalized, the issue, the challenges that immigrant parents face because they have to work a lot, the lack of interest in interacting with police and other authorities that are considered a threat, reluctance to share personal experiences in support groups. Often the services that are offered are groups, and sometimes there's not a big interest in that. Multi-generational families, everyone in the family is involved in finding solutions. And with respect to social media, tying in to our overarching theme today, is that yes, the immigrant population does use social media mostly on their smartphones, and it's a pretty important way to keep in touch with their family members, and it is considered a credible source of information. So this is just, due to time, I won't go into too much detail, but for the Spanish-speaking group, we developed a fotonovela, or a graphic novel, that had 2 characters, an older one and a younger one. It was actually 2 stories, so a total of 4 characters, one dealing with mental illness diagnosis, another with substance abuse, and it challenged stigmatized beliefs. Here's the other one. And Lorene, are you able to unmute your phone and speak about this? We were going to try to tag team, but I don't know if it's going to work. So
okay, can you hear me?
What, for the Haitian community, we wrote stories that were meant to be audio stories. So the conventional wisdom and the marketing wisdom here in Miami is that to reach the Haitian community, you reach them through radio. So we developed stories, again, based on archetypes. And because we were, you know, it's limited the number of times we could actually play it on the radio because of cost, we also put it on YouTube. And then once it was on YouTube, we wanted some images, and we had an illustrator create some images. So in terms of evaluation, what we did, we've already formally evaluated. The fotonovela was done with a questionnaire. The radio story was done with a focus group. The fotonovela, we had quasi-experimental design in 2 different community events. We randomly assigned people to either the fotonovela group or the standard method to combat stigma, which is a myth and reality presentation. There's many fact sheets around that are meant to combat stigma, that are basically present the stigmatized beliefs and then challenge it with reality. So the discussions were led by the same educator, by the same peer leaders. The participants were primarily females, and the questionnaire asked about knowledge and attitudes before and after the intervention, and then there were no observed interactions between the group members and self-disclosures of mental health concerns. And then for the Haitian group that unfortunately Lorene apparently can't present, it was a similar mechanism, but instead of having a questionnaire, it was done with a focus group.
Actually, Marilena.
So in general, in short, for both groups, we found that in terms of, you know, based on a pre and post questionnaire or focus group, whether we use the culturally based stories or the traditional myth versus realities discussion, in terms of moving attitudes and increasing knowledge in the desired direction, they both worked. Of course, it's an immediately post, so it's also basically a measure of retention. But where there was a big difference was in the engagement with the messages. With the culturally based stories, there was a lot more conversation among the participants, a lot more self-disclosure of personal experiences with the issues being discussed, and and more requests for tangible referrals for services. And then just qualitatively, there was high levels of satisfaction with the storytelling products created. People were grateful to see things that clearly came out of their cultural group just because of the language, the slang that was used, and just the images. So the role of social media, even though it was not part of the study design, is important, because social media was how we shared the links to these materials, was how we invited people to participate in our groups, how we debriefed with participants when we told them we'd get back to them with our findings. We sent them. So the 2 main mechanisms were Facebook and text messaging, SMS. So I think that our project is an example of how, you know, for many communities, low technology kind of interventions are still very relevant, very welcome, things you can take home, things you can touch. But social media is a very valuable tool, and it helps with recruitment and for engagement. So in terms of implications, culturally, we think our experience supports the need and the success of culturally based interventions. We do need more longitudinal research to measure sustained changes in knowledge and not just immediate retention of knowledge. and of course, to what extent social media can be a tool to boost the sustainability of that knowledge and attitude behavior change. So I hope that our project it has been interesting for you, and I'd love to hear your questions later.
Great, thank you. And I think Lorene was trying to speak in the middle.
You're muted.
She's still muted, yeah. But if you want to add something to it right now, we have the time if you'd like to.
Can you hear me?
We can hear you well, yes.
Okay. What I wanted to say also in terms of social media for the audio stories, they were distributed on YouTube, which also facilitated the distribution within different communities and different organizations and networks. So that was just to add to the part about how social media can still help communities that have limited or low access to technologies.
All right, thank you. And now we'll go to our second paper presented by Aaron Deason. And the title of it is Grumpy, Happy, and Other Smurfs, the content analysis of a Twitter account to find paramedic mood.
The best title.
Best title.
Aaron, you're muted.
There we go. Is that better?
Yeah,
Yes.
now we can hear you.
Okay. Well, the title came to me one night. I ride my bike a lot around Camp Indianapolis, and what it is I'm a combination of two worlds. I worked 14 years as a paramedic before I came back to school to finish my bachelor's degree, then get a master's, and now I'm a PhD health communication person. As you can see right over here on the slide, that's what my office looked like for 14 years. You know, the cardiac monitor, and these are things I saw every day. And as I started thinking about paramedics, I have a lot of friends who are still paramedics, and I look at their tweets, and it made me start thinking, how can we do that? Because basically what happens whenever we look at paramedics, there's certain tools we have. And the tool we have, we have the cardiac monitor, and you can see here the cardiac monitor that this is a tachycardic rhythm, and it shows how fast the heart's beating, it shows capnography, or how we're breathing, how good, how bad we're breathing. And ultimately, this is kind of like a vital sign, especially if we're talking about an unconscious patient. And this unconscious patient, we're not able to see or tell what's going on with them, except for the vital signs that we can see on the monitors and machines we have. Those are some of the tools of the trade that the paramedic has. And what's interesting is we have blood glucose, and we can see what's going on, and we can start to diagnose and treat what's going on. Well, if you see from this picture, that's after a really bad call. And we think about the paramedic, and they're trained to internalize a lot of things and to just deal with this. And so what happens is, let me see, is it flipping over yet? Okay. What happens is this paramedic sees a lot of ghosts in their lives. And one thing is that paramedics are usually, Tangerlini and all them found out that paramedics are pretty much by themselves all the time. They have a partner, but there's not another paramedic around. And so what happens is now this paramedic starts to internalize things and keep it inside themselves. And so all these ghosts that they see, they don't have much to deal with. And they concentrated. And what I found is, as I've done research, I developed this thing called discommunication, where it's a treatable thing. But this discommunication is dysfunctional, kind of like dis meaning not normal, and is abnormal. So what they do is, as I was looking at this, how do they express their emotions? How do they do this grumpiness? How do they do the happiness? How do they do all the hidden little blue smurfs? I mean, because we think smurfs are the hidden blue things that we can't see. So they have all these emotions, and it started to make me think about Twitter. Twitter is a lot like the paramedic encounter. The paramedic encounter with the patient is really quick, it's really rapid, they have to think, there's not a lot of time to do much things. And so like the Twitter performs the best. I wanted to look at how the Twitter platform allows the paramedic to communicate quickly in the short character, 140 character. Now, the cool thing about it is it's really quick, it's easy, and it has a lot of reach. unlike the paramedic who may have at one point the nearest paramedic to me was 60 miles away. I didn't have anyone to talk to. So this allows a great reach out into the Twitterverse, as we call it. Well, now if we compare the two, the tweets and the paramedic mood, well, basically, as we look at the analysis of the message that's sent out, we can look at the moods, the feelings, the thoughts, the humor, and we can find the hidden messages that are there and help determine the inner beast. Much like the paramedic would do with the unconscious patient, they would look at the signs and the symptoms, the heart rates, the respirations, the blood pressure, the D-stick, medication, people are standing by. And what it takes is, it's interesting as we start looking at all these things that we can find kind of what's going on. Now, it takes an insider to look at these tweets and kind of see what's going on with them. So what we did is a single case study, and actually it's an autoethnographic single case study taken from the last 2 years as an active paramedic. I did 14,000 tweets in a little under 2 years. Now, we found the days that I was on duty, and found especially things were explicitly EMS related. If I'm chit-chat with my wife, it didn't count. And out of those 14,000 tweets, we analyzed 1,487 of them, found that were specifically on duty and EMS related. And from that, content analysis, we found 8 categories and themes. Now, if you look there, the 8 categories are anger, funny, happy, information, sad, sarcasm, thinking, tired, for a total of 1,487. Now, if you look at those 4 categories of anger, sad, sarcasm, thinking, tired, that is over 40% of what I tweeted was a negative emotion. Thinking about some of the things that were going on. So we look at these, and what do they really say? Well, if we think anger is being wrong, offended, or denied, we look at some of the tweets like, I stink and smell, haven't slept in forever, wearing dirty EMS uniform for 46 hours. I just got administrative approval for vacation time for March. Glad didn't have to change my plans. Didn't have relief and had to work an extra 36 hours and had to cancel my family vacation. Now see, as we look at these, that could start to be the grumpiness. And those inner feelings, because we can't express them much, are indicative of some things that might be going on leading towards that downward spiral that causes problems with psychological, also anger issues that we can't do. Now, the sarcasm is pretty interesting because we use irony to mock or convey contempt. And the first one is, read the obituary that lists close friends as pallbearers. Did he have that few friends, or did he weigh so much they called all hands in? And that is really, I mean, it's really mocking, but as I look at other paramedic tweets, they do have this sense of sarcasm. You know, I would highly recommend getting up early in the morning and sitting on the roadside watching sunrise and cars driving by. Those are to try to control the emotions, because, once again, we're in the public eye, and there's a lot of stuff that's going on in the mind, especially after cardiac arrest or some of the bad things the paramedics see. Beaton found that 86% of paramedics had seen a cardiac arrest or some traumatic, really bad thing in the last 6 months. And I can attest that, and talking to some of my paramedic friends today, that number still is true. Now, here's the other thing, the sad. Comes from hopelessness, despair, sorrow, or loss. And another friend died last night, makes 4 in last year. Good men, rest in peace, my friends. Wondering if anyone is seeing through this brave facade I'm wearing. And once again, it's an internalization, because my wife didn't understand it. The wives don't understand it today. And so with each of these that's going on, the paramedic has to figure out how to deal with it. Because the other ones, there's no one to talk to. And so what happens is, that's what leads to a lot of PTSD, the ghost that we saw in one of the first slides, all this trauma, all this death, the badness of humanity and the badness of society is what paramedics see day in and day out. And yet it's one of the one things. And so what we can do, really, what do these tweets mean? Well, negativity could indicate underlying psychological problems. Because there's not an appropriate release, and because they see so much, I mean, the DSM-5 says that there's certain criteria, and obviously there's a lot of paramedics who meet that criteria, for PTSD. I was diagnosed earlier last year, and it makes a lot of sense, and I know the triggers. And really what happens, and this is what Hammer, and it was really impressive, this is from 1986. Hammer said, the absence of fatigue, sickness, and other psychophysiological markers of stress may mislead the supervisors into believing that paramedics are not stressed. The critical markers of occupational stress within this population may be what the paramedic says about his organization, his coworkers, and his patients. That's true, because it's not, I went to work, I worked a 72-hour shift, I worked a 96-hour shift, I was working 144 hours a week, and it was never about sickness. I didn't call in sick in 14 years, but they think everything's fine. But what happens is the underlying things, and that's why we look at the tweets. Well, like Hammer says, this is just one case study, but we need more research. It is a small population, but what we do is we start looking at other paramedic tweets, and then we can see, and this is a really stretch, and I fought with this for a long time, that what if companies, what if people were actually using the media ecology that has a surveillance function, looking at some of these tweets, looking at the tweets and the Facebook posts of other people, not for remediation, but to monitor their paramedic mood to help them deal with PTSD. And that's some of the things I think that we can do to help that population using social media, is to find out and help them deal with these in more constructive ways than the ways we're doing it now. All right. That's it.
All right, thank you. And our third paper is by Jeanine Guidry, and the title of it is Online Engagement and Data Dissemination in Community-Based Participatory Research Studies.
Thank you, Scott. Aaron, I can't follow that title or that presentation probably. That was great. I did some work recently with a community-based participatory research project, which is the first time I did that. And I have quite a bit of social media research I've been involved in. So when I started this work, I started wondering how much these projects were actually using social media. Or this way? Okay. Community-based participatory research is a research model in which the research process itself is intended to benefit the participants of the research and the communities in which they live. So the link between research coordinators and the professors and the researchers and the participants is very close. And while you usually try to keep some distance to try to keep objectivity, in this case you actually involve the participants in the community in your research projects. And you build capacity so you can address a health issue of interest. It can be obesity, it can be a mental health issue. But basically, and a lot of times the researchers are in the community itself and functioning and working within the community. It's a model that is gaining quite a bit of popularity. And the data of the research is also disseminated into the community often as the project is going on. And a lot of times you train people from the community to do a little bit of data collection and do basic levels of analysis. So there's a real close link, which to me started looking at social media, how that could be used, because it's such a great tool to get the word out. Excuse me. The research questions in this case were very simple because no one had looked at this, as far as we could tell. So what is the use of social media among a self-selected group of CBPR projects? What we did is we got in touch with someone who had just asked this question and basically had tried to collect as many social media projects run by CBPR projects. So this is not a random sample by any stretch of the imagination. This is what we could find on websites, on Facebook, and on Twitter. And then we looked at how social media is being used by these projects. We also looked at what the response was to the different messages they used and to the different strategies that were carried out. Like I said, this was a self-selected sample. We used a content analysis approach. We looked at websites, Facebook sites, and Twitter accounts because there were no Instagram, Pinterest, or YouTube accounts that we could find. So this is the presence of the accounts that we could find, and the Facebook accounts were divided into groups and pages, and I'll get into that a little bit later. So the study sample is a convenience sample of CBPR websites and social media profiles, and the list came from the Center for Community Health in Chicago. The final list was 21 websites, 7 Facebook pages, 7 Facebook groups, 4 Twitter accounts, and this was for a total of 22 organizations or 22 projects. So almost all the projects had a website, not all of them. One of them had a Facebook group instead of another presence, and very few in the end ended up having a Twitter account, but the data was interesting that we found. Limitations of the sample, of course, are that this is not a random sample by any stretch of the imagination, but it's a level of formative research to kind of get an idea of what these projects are doing. These are usually intensive projects as far as manpower, as far as funding, and social media could be a good source for them to link the community together, and so that's why we started this. So here's the main results. 90% of the websites used photos, and almost 50% used videos in some way, shape, or form. The interesting thing is that less than 40% mentioned CBPR or PAR, which is another term, on their site. So only 38% actually mentioned that their project, this is what they're doing, and explains what it is. And a little over 65% reported the study results of any kind, and a little over 60% also listed publications, either through PDFs, through links through articles that were produced, or white papers, or publications that were for the community specifically. For Facebook, like I was mentioning, 7 of the Facebook presence were pages. So pages are meant as for a more public relations approach. They're universally accessible. Anyone can like a page. It's something that's easy to get the word out, and it's an easy tool for a level of marketing and a level of PR. Groups, 3 of the projects only had groups, and groups can be a more internal communications device. They don't have all the tools that pages have, but they have a lot more tools to actually communicate and share information. The likes on pages were a great range, from 19 to over 16,000. The members in groups, that was a little bit less of a wide range, 138 to 353. And engagement on Facebook pages as well as groups is likes, shares, and comments. People can like, that's the quickest form of engagement. They can share a post with their followers or their friends or people who like their page, and they can leave comments. And comments is, of course, the most intense way, the most time-intensive way to interact with the Facebook page or with a Facebook group. 61% of the posts, all the posts, so we analyzed some of these together because the engagement tools are the same. A little over 60% of the posts received likes. That was a fairly good level, but then it drops off pretty dramatically, and that's pretty representative for Facebook. A little under 20% of the posts were shared, and almost a quarter received comments. So almost a quarter of all the posts actually got people commenting and responding back to the people who were posting. 3 of the projects, every post that they posted received likes. And 3 other projects received no comments whatsoever. And so you can see a real difference of how active these pages are, how active these groups are, and these in some way they lined up with a number of likes, but not in all ways. For example, the the page that had 19 likes did not get a lot of comments or shares. But the page with the most comments was a page that had, I think, 1,000 likes total. So not by a long shot, the most likes, the most, what you would expect to be the most active page. There we go. We dug a little bit deeper. There is a classification of social media posts that came from a study 2 years ago. And they classify social media posts the following way. Public education, meaning getting the word out about the issue that you are trying to address. So if the goal of the project is to reduce obesity in a community, these posts would be about cooking healthy meals, exercise programs, things to support the goal of the program without directly promoting the program. Marketing posts are exactly what it sounds like. Marketing the project directly. Look at what we're doing. Look at how we are doing things. Here's who we are. Here's our link. Here's our photos. Here's what we do. Community building are posts that actually directly try to connect and engage people. This can be through a direct mention. It can be through asking a question. It can be through linking to someone as a linked mention on Facebook. Or later on Twitter. Event promotion, these next three are all in some way calls to action. Event promotion is, of course, promoting an event, promoting a community event, something that's happening in the community. Funding, fundraising, we found none of those, which is a good thing because they tend to not get a lot of engagement, but that is another category. And then the third one is calls to action, asking people to do something specifically, except give money. So asking them to come to sign a petition, asking them to involve their neighbors, asking them to like a page or to share a post, those are calls to actions. In previous studies, research has found that community building posts and calls to actions receive the most comments, the most likes, and were shared the most often. And those are the posts that you would recommend that an organization in general would use. And this was a study among nonprofits, which is fairly related to CBPR projects. 3 of the projects do not use any community building posts, and 3 of the projects, other projects, do not use any call to action posts. What that means, we'll have to look further into that. But one of the interesting things is that the project, the Facebook page that got the most likes and the most engagement in that area only use public education posts. So these principles work in general, but you always have to take a look at what someone is doing specifically and why they are successful. So moving on to Twitter, we only analyzed 4 Twitter accounts because that's all we had. But we found that still some interesting results. Again, the followers range was wide, 17 to almost 20,000. And the number of Twitter handles that these accounts followed ranged from 59 to almost 18,000. So again, this is, and yes, they do match up. The 17 goes with 59, and the almost 20,000 goes with 18,000. The good thing about that is that a lot of Twitter handles do not follow people back. And especially when you are dealing with community-based research and you're trying to engage community, following people back is really one of the best practices because it shows engagement. It shows that you want to engage back, and that really is the power of social media, being able to connect with your audience and have them respond to you and have a conversation going. And that's one of the things that we got from this entire thing that's been going on for about 15 years now. Engagement on Twitter is retweets and favorites. 56% of all the tweets were retweeted, and 45% were favorited. That is an interesting percentage because usually you find that a lot of tweets have been retweeted, but most people don't favorite tweets. So this was sort of balanced in that. And the mean number of retweets for the project, this was the sad number, and that is, those are low. These are low means, 2.4, 1.8, 1.1, 2.3. These tweets are not being retweeted all that much. And you would maybe expect that for a Twitter account that has 19 followers, or 59 followers for that matter, but an account that has 20,000 followers, you would hope they would have more engagement. So the tools that you can use on Twitter, because obviously Twitter, 140 characters, You are limited in the number of words you can use. But you have a lot of tools that you can use to make sure you fit in the things you want to fit in. Hashtags, mentions, direct replies, which means you put a mention at the beginning of a tweet, you directly address someone, retweeting someone else's tweet, using a hyperlink, including a photo, including a video. And again, 67% used hyperlinks. Only 45% of the tweets used hashtags. That is a fairly low number. And 44% used mentions, 21% photos, and 2% listed research results. So on Twitter, on Facebook, a fair percentage actually is research results. On Twitter, that was 2%. It basically wasn't present. Going back to the 6 categories, again, the majority of tweets were public education. And if we look at the 2 categories that from the research we know that people should be using, 17% community building, and only 3% of all tweets calls to action. So this is something to keep in mind. This might be something to recommend to these groups that are tweeting. This would be something fairly simple to put into practice. So looking at best practices, only 10 of the 22 projects have a Facebook presence. Only 4 have a Twitter presence. These are projects that deal with doing research that involves the community that they're trying to affect. And social media is, in a lot of ways, a good way to reach people. It's not the only way. It's not the only way to involve people, but it's something that doesn't cost a lot of money. It costs time, and we think that that's one of the reasons why not as many of the projects use these. It also requires a little bit of skill, because just because you have a personal Facebook page or have a Twitter handle does not mean you know how to do this for a project or for a research project. The project that has a Facebook group really should consider also creating a Facebook page. These are different strategies. They have different goals, different things you can do with them. And while a group is really good to communicate with your team, with your volunteers, with your other researchers, with people in the community, and have conversations, a page is more of a business card. And it's probably good for these groups to have both, because some of the groups have fairly proprietary conversations going on about how we're going to get to the next event and what we're going to do for the potluck next month, which are good conversations to have, but those are internal group conversations and not so much what you want to advertise to the people who don't know you yet. The fact that 38% of the posts on Facebook received no likes and 81% were never shared and 76%, more than 3/4, received no comments, means that there's a lot of growth to be accomplished in engagement, because of course Facebook makes it harder and harder for your posts to be seen. Some of these groups may want to look at a limited amount of Facebook advertising, or just get their communities involved, because if they get involved, they will start pulling up the page and not depend on what comes up in their newsfeed. 94% of the posts did not include one mention. And a mention is basically calling someone out on Facebook, saying, hey, so-and-so, what do you think of this? Hey, these 3 people went with us to this event, and we love having them. It is a great strategy to involve people, and the fact that very few of these posts did that is something that I think should be considered. And the same thing on Facebook. Consider using more mentions. Again, mentions are more popular on Twitter, but they're also very useful on Facebook. So finally, the greatest success was a page called Annabelle and Sudi, and this was a page of a side project of a bigger project of dogs that are being trained as support animals for people in recovery from drug addiction. And all the page is photos of these dogs, and basically the dogs talk and say what they're going to do and how they're being trained. And they're giving information about the project that way, and they basically blew everybody else away. Secondly, Twitter is not used much and probably should be used more. The posts on both Facebook and Twitter should start leaning a little bit more towards calls to action and community building. And talk about your study results, explain what CBPR is, because these are projects that are related to the community. You want the community to know what you're doing, and you want them to know the results So leaving them out of Facebook and leaving them out of Twitter is leaving that entire venue unexplored.
Excellent. Thank you, Jeanine. And so Marcus Messner will lead a discussion on the 3 papers.
Okay, great. So we have a little bit of time left, and we have a couple of questions on Twitter. So let me do this in reverse order. And a disclaimer, when I talk about Jeanine's paper, she's my doctoral student, so so you get a little bit of feedback here. And so what I thought I'd do is talk about a couple of things that struck me with these presentations, and that I think that should be addressed when you send this out for publication, or when you finally finalize your manuscript. For the research design of your study, something that was not absolutely clear to me is how the sample was selected. It's a self-selected sample. I think there were 22 projects total, which even means one didn't even have a website. Okay. It actually reminded me kind of the nonprofit research that we did a couple of years ago when they started using social media and going into the online space. So it looks like that these projects are in a very similar place. So I think you need to explain the sample better, how they were selected. It also, you're not reporting in your results, you're not reporting the N, at least in this presentation, so what are the total numbers? Yeah. My suspicion is that they're fairly low, yes, right, because you only have a few, yeah, accounts. So if you think about finishing this manuscript and sending it out for publication, I would think about how can you expand your sample possibly to take this study as a starting point, right, and then expand the sample so that you get a higher N and possibly also can test for statistical significance of your findings, yeah, right? So total number of posts, I think there were only 4 Twitter accounts. Those are some of the notes that I have. That was the main thing that I immediately saw was, you need to find a way to better justify that sample, because a reviewer who will look at the study will immediately catch a reviewer's eye. Okay, but great job. For Aaron, you've already been crowned as the one with the best entire symposium on Twitter. I think somebody here said it as well. One thing that of course, I had your presentation before you presented today. One thing that I did not see from your presentation when I just had it in front of me without you talking was not clear to me that this was an autoethnography. When you write up the study, this was your Twitter account, right? So when you write up that study, I think if you want to publish it, or if you want to go forward with this case study focus, I think you need to make that very clear. Otherwise, there will be some concerns by a reviewer who says, "Why only one account?" Well, when you say this was mine and I actually did this before I planned the study, right? So all these tweets were posted while you were still working as a professional, and then later on you went back as an academic to look at it. What did I do, and what can I read into these tweets on my personal mood and condition? I think that needs to be made much clearer when you write up this study, and that is that was not clear to me actually until I heard you present.
Right.
So I think that there is a place for autoethnographies in our field. So I think that's something that you need to make much more clearer, and also find the literature that will justify your approach, and you can find that literature. Also, it wasn't clear to me how you narrowed down. Again, comes back to samples, same with Jeanine. How you narrowed down that sample from 14,000 to 1,487. How did you select those, right? So were they randomly selected? Are those the first ones? Are those the last ones? Those are the ones that are available, right? So that's something you need to justify in your study. I would also take the study similar to Jeanine as a starting point, and actually I think you have a very valuable research topic here. that can really break some new ground. So can you identify other paramedics and make it a bigger study, right? So that you could possibly come up with a sampling technique where you're saying I'm looking at the biggest cities, and then I'm randomly selecting somebody from so and so many cities, like 50 cities, and have a bigger study, so that you can actually get to some generalizations, right? Right now, the results show the mood of you, right? There's a lot of meaning in that, but if you want to have a more rigorous study and a more generalizable study, I think that would be a good way for you to move forward. I'd also suggest that you do a more detailed qualitative analysis, which you started for this presentation, but so that you have really strong categories that derive from the qualitative analysis that you're doing, and it will also allow you to make your results stronger, and to go beyond what's just obvious at the surface. Also, work on what's the consequence. Okay, what can we learn from this? What's the specific takeaway for the medical profession looking at paramedics and the possible problems that they might have? I think that's really the core of why you should follow this research. What can we learn from this, and what's the consequence? Okay, you will have the best practices to identify psychological problems possibly with paramedics and what to look for by analyzing the Twitter accounts. So thank you for taking your research as well to our symposium. And then Elena and Lorene, and a disclaimer here as well, Elena and I did our doctorate together at the University of Miami, so we know each other for quite some time. And I know this is research that is really community-based, right? So you might not actually thinking about taking this to an academic journal, but this has real-life consequences in your community, and I think that's where the research should be located. If you were thinking about taking it to a journal afterwards, I think for the methodology, you kind of need to explain more where these focus groups that you conducted, how were the experimental, are you preparing those, or was this already done? So a more detailed explanation of how the methodology was actually carried out. That was not very detailed in your presentation, of course, but in a research article. That's probably what a reviewer will look for, a more detailed description of the methodology. And something that I also thought, and that would be really interesting, and of course I lived in Miami going to graduate school there and know the diversity of Miami pretty well. Has your study consequences for other areas? There are other states where there are huge Hispanic populations, Texas, California, of course. But does it have consequences? Can your research be used to actually communicate with the Hispanic population, let's say here in Virginia, where we don't have a really huge Hispanic population? Scott, correct me, I think it's like between 5 and 8%, depending where you go, so below the national average. But there are problems communicating effectively with that population because it's not that big, and so the priority for public funding and things like that it's not as high as in Miami, right? So I think you could your research could really be strong if you show how it can be applied in different areas of the United States, especially where there are well-sized Hispanic populations, but they're not the dominant population like it is in Miami. So I think that'd be something that if you take this to a manuscript and you want to send it somewhere, I think that'd be really, really valuable for you to look at. I really like that you pointed out, Facebook text messaging, some of the low tech plays a big role, but social media plays a big role in minority or majority populations in Miami-Dade, minority populations in many other places of the U.S. So thank you very much. So I thought it was a really, really interesting presentation as well.
Okay, very good. Well, we're right about 5 o'clock.
Okay. Check for some questions.
Yeah, let's check for some questions on Twitter. Let's see. You go ahead.
Got some
Jeanine's
questions?
been following our Twitter, so we'll just go that route.
A question for Maria. Do you think that publics engage more with the social media messages because they were visual as opposed to textual?
So I'm thinking of two dimensions to that answer. One is that, yes, when possible, people generally do prefer visual, less reading, more, you know, like memes and photos and humor are popular. But then again, not everybody has phones that can do that. And so a combination. I think what we've learned is a combination. People like to be reached out through social media. They don't want to be excluded from that. But we have found that sometimes there are barriers because not everybody has the same level of technology. So, but as a rule of thumb, at least in Haitian and Hispanic communities, visual, colorful, funny are always good.
And Aaron, one question for you. Did EMS workers tweet about specific incidents, or did you tweet about specific incidents or emergencies with which you assisted? And if so, were those tweets positive or negative?
Well, company policy in HIPAA says no, you can't. Otherwise, you get fined really big. I did want to talk to Dr. Messner. I wanted to do more, but nobody in my department had ever done a social media analysis, and so I wanted to go really big. They said limit it to autoethnography, so I agree with you. And the tweets, you can't really say things because they can identify what's going on. So most of it's just saying, that sucked. It's a really bad day. I was looking at a friend just on Facebook now, and he tweeted something about pushing his cot up the snow in New York. He can't really tweet about the call, but he can talk about the badness of it. So, no, they can't, but the mood is there. It's just hard to find something.
Well, I think we've had a big, long day, and it's 5 o'clock. And so I want to thank everybody for participating. These two especially, the folks back in the other room, and everybody on Google Hangout. Marcus, you want to say a few final words?
I think we should say a thank you to all of our colleagues here that have worked really hard for us. Candice Parrish and Osita Irefu at the registration table and in the audience room. Jeanine has been with me here in the speaker room all day trying to fix PowerPoints.
Jeanine's husband Chris,
husband Chris helped as well. Scott, of course, thank you for organizing all the great food, running the audience room. Rowena Briones, we have still here off camera with us in the room, was here with us all day. Grace Park, Shana McGang, they have all worked really hard to make this symposium happen.
We should also thank support we've gotten from the school with Dr. Hong Chen, Dr. Tim Bykavich, the support we get from the college, from the university.
Right, and not to forget the All Lab here, and they're already going home, and we're still occupying the space. So thank you very much for everything. And then thank you to all of you, our presenters, for making this happen. We hope to be back next year and make this a regular. And by next year, we have all the tech running absolutely smoothly, correctly, right?
Oh, yeah.
And so, but I think we had some really good presentations with this symposium, and it was great to have people from so many different backgrounds and so many different locations, all the way to Switzerland, presenting here at the symposium. Yeah.
Thank you.
Okay, so thank you very much, and please let us know how you like the symposium, what we can improve, what we should do next time. Just comment on our Facebook page, the Center for Media Health at VCU. We'd love to hear from you, and to keep the conversation going on Twitter using the hashtag VCU Global Health. And so everybody have a good weekend, a good evening, and we hope to see you soon. Okay? Thank you.